Every year, more than 800,000 Americans die suddenly. Some from auto accident, some from drowning, from choking, electrocution, poisoning. But the most common cause of sudden death is heart attack. In many cases, the victim might have been saved if he or his family had known the early warning signals, if he had gotten to a hospital in time, or if someone near him could have performed CPR, cardiopulmonary resuscitation.
CPR?
The purpose of this film is to teach the basic steps of CPR. With the knowledge you receive, you will be able to maintain a person's life until additional medical help can be obtained. With just your hands and lungs for tools, you can keep the basic life support system functioning. You can be the difference between death and life. Before learning what to do for a cardiac arrest, it's essential that we all know how to recognize it and how to recognize the early warning signs of heart attack. The most common warning is a steady feeling of pain or pressure on the center of the chest, lasting 2 minutes or more. The pain often radiates to the shoulder, arm, neck, or jaw. It can be accompanied by shortness of breath, sweating, nausea, and vomiting. Sometimes these symptoms may subside and then return.
Get the fire department on the phone.
When confronted with a heart attack victim, immediately call your fire department, police, or the telephone operator and ask for a paramedic rescue unit.
Hello, can I have the fire department, please?
But what if you come upon someone whose symptoms have progressed to unconsciousness? What if there is no one else around who can help? What if you must do it all yourself? This is when you'll need a knowledge of CPR. So let's take a look at the techniques of CPR, step by step. First, assess the situation. Is the victim conscious or unconscious?
Are you all right?
A perfectly effective method of determining this is to shake the victim's shoulder and shout, "Are you all right?" If he doesn't respond, you must proceed with your ABCs. The ABCs of CPR are airway, breathing, and circulation. The first step after assessment is to open the victim's airway. This is a model of the airway, the passage between the mouth and the lungs. Note how the tongue of an unconscious person sags against the back of the throat and blocks the air passage. When the head is tilted back, however, the tongue comes away and opens the airway. With the victim flat on his back on a firm surface, lift his neck with one hand while pushing down on his forehead with the other. Place your ear next to the victim's mouth and listen for sounds of breathing. At the same time, look at his chest and stomach. You should be able to feel his breath on your cheek and see if his chest or stomach is moving. If these signs are not present, he is not breathing. Check the airway again to make sure it is in fact open. If the victim is still not breathing, you must breathe for him. Rescue breathing is most commonly provided with the mouth-to-mouth technique. Taking the hand that is on the victim's forehead, pinch his nose closed while keeping the heel of the hand in place to keep the head back. The other hand stays under the neck, lifting it up. Take a deep breath. Open your mouth wide, place it over the victim's mouth to provide an airtight seal, and blow in. Rescue breathing is initiated with 4 quick, full breaths. The rescuer then removes his mouth from the victim's mouth and, turning his face toward the chest, listens for the sound of exhaling air while looking for a falling movement of the chest. If you hear the exhalation and see the chest fall, you are performing mouth-to-mouth resuscitation properly. Simultaneously, the rescuer checks the victim's carotid pulse to see if his heart is beating. This begins the circulation portion of the ABCs. Cardiac arrest can be recognized by the absence of pulse in the carotid artery. To find the carotid pulse, take the hand that is under the victim's neck and locate the larynx, the Adam's apple. Slide the tips of the fingers into the groove adjacent to the larynx. Don't press too hard. Pulse may be found on either side of the neck. If you cannot find a pulse within 5 seconds, you must provide artificial circulation as well as rescue breathing. The heart is a hollow muscular organ located in the center of the chest. When it stops beating, breathing also stops, usually within 30 to 45 seconds. This is the condition known as clinical death. If circulation and breathing are not restored within 4 to 6 minutes, the brain will suffer irreversible damage from lack of oxygen. This is biological death. Artificial circulation is provided by external cardiac compression. The heart is located between the spine and the sternum, the breastbone. By compressing the lower half of the sternum, the heart is squeezed against the spine, forcing blood out into the circulatory system. When pressure on the sternum is released, the chambers of the heart refill with blood. External cardiac compression is performed with the victim on his back on a firm surface. It will not work if he is lying in bed or on anything soft. Kneel beside the victim's chest and with 2 fingers locate the xiphoid process, the lowest tip of the sternum. Position the heel of the other hand alongside to give the proper distance of 1 to 1.5 inches from the tip. This is most important since pressure applied directly over the xiphoid can cause severe injury to the liver and other vital organs. Place your other hand on top of the one already in position, being sure to keep your fingers off the chest wall. This may be easier if you interlock your fingers. Bring your shoulders directly over the victim's sternum and, keeping your arms straight, compress downward about 1.5 to 2 inches. Relaxation immediately follows compression and is of equal duration. A rhythmical motion helps ensure the proper timing of the relaxation cycle. If you are the only rescuer, compressions are delivered at the rate of 80 per minute, with 2 quick ventilations given after every 15 compressions. You must provide rescue breathing as well as cardiac compression. When there's another person to help you, position yourselves on opposite sides of the victim. One will perform chest compressions at the rate of 60 per minute, while the other interposes 1 breath after every 5th compression. This breath must be given without any break in the rhythm of compressions. It is recommended that the rescuer doing ventilations periodically reassess the victim's condition by checking his pulse and eyes. If CPR is being performed properly, you should be able to detect a carotid pulse and usually note a constriction of the pupils of the eyes when they are exposed to light. When one rescuer grows tired, switch positions, but take care not to break the rhythm of compressions and ventilations. When performing CPR on an infant, care must be taken not to exaggerate the head tilt. An infant's neck is so pliable that forceful backward tilting might block the breathing passage instead of opening it. It's important that the rescuer cover both the mouth and nose when performing the ventilations, using small puffs of air to inflate the infant's lungs. Pulse is best found by placing 2 fingers directly over the heart. Only the tips of the middle fingers are used for compression, with the other hand slipped under the child's back to provide a firm support. Compress the chest at mid-sternum between 1/2 to 3/4 of an inch using a compression rate of 80 to 100 times per minute. The ratio of breaths to compressions is 5 to 1, both for a single rescuer and 2 rescuers working together. On older children, the techniques change as the child grows larger. For a small child, compress the mid-sternum 3/4 to 1.5 inches with the heel of one hand. The rate is 80 to 100 times per minute, depending on the size of the child. Here's a comparison of the different compression-ventilation ratios used in different situations. With 2 rescuers performing CPR on an adult, the compression rate is 60 per minute, with 1 breath interposed after each 5th compression. For a single rescuer, the compression rate is 80 times per minute, with a ventilation ratio of 2 per 15 compressions. If the victim is an infant or small child, the compression rate depends upon the size of the child, between 80 and 100 compressions per minute. The recommended ratio of compressions to breaths is 5 to 1. This gesture means that breathing has been cut off by some foreign object in the airway, usually food. If the victim's airway is only partially obstructed, do nothing except encourage her to try to cough up the object by herself. If the obstruction is complete, however, and she has not yet lost consciousness, first deliver 4 sharp blows with the heel of your hand between her shoulder blades. Then, encircling her waist from behind with both your arms, grasp 1 fist in your other hand and, pulling the fist into the abdomen, deliver 4 quick upward thrusts. This maneuver causes an increase in pressure in the victim's air passages and should dislodge the obstruction. If it does not do so, try again. If the victim becomes unconscious, or if he is unconscious when you discover him, first try to ventilate using the mouth-to-mouth technique. If you are unable to blow air into his lungs, roll the victim onto his side, facing you, with his chest against your knees, and deliver the 4 blows between his shoulder blades. Reposition him on his back and place the heel of 1 hand against the victim's abdomen, between the navel and the xiphoid. Place the 2nd hand on top of the first and press upward into the victim's abdomen toward the chest with 4 quick thrusts. An alternate to the abdominal thrust is used when the victim is in advanced pregnancy or is grossly obese. Place 1 hand on either side of the victim's lower chest, with the heels of the hands in line with the nipples and above the lower edge of the ribs. The fingers wrap around the rib cage, and with a quick downward and inward squeezing motion, compress the chest cavity 4 times. After the 4 back blows and 4 abdominal thrusts, the rescuer attempts to remove the obstructing object manually. Placing the thumb on the victim's upper teeth and the index finger on his lower teeth at the corner of the mouth, force the mouth open by pressing upward with the thumb and downward with the index finger. The index and middle fingers of the other hand are now run down the inside of the victim's cheek toward the base of his tongue, deep into the throat. The fingers are moved with a sweeping motion across the back of the throat, attempting to dislodge the blocking object. Repeated attempts may be required. If the rescuer is unable to dislodge the object, or if it is impacted deep in the throat, the sequence of attempting to ventilate, 4 back blows, and 4 manual thrusts is repeated. If the object can then be removed, look and listen for signs of spontaneous breathing. If there are none, deliver the 4 full breaths. Check again for spontaneous breathing and simultaneously palpate the carotid pulse. Continue with CPR if required. Sometimes when performing CPR, there may be reason to suspect a neck injury. This is especially true if any kind of accident is involved. In such a case, the airway is opened with a technique called the modified jaw thrust. Place the hands on either side of the victim's head so that the head is maintained in a fixed neutral position without being extended. Use your index and middle fingers to move the lower jaw forward without tilting the head backward or turning it to either side. Rescue breathing can now be performed either mouth-to-mouth or mouth-to-nose. Mouth-to-nose breathing is often used in accident situations when the victim's mouth is injured or when it's difficult to achieve an airtight seal. Keep the victim's head tilted back with 1 hand on the forehead and use the other hand to lift his lower jaw. This seals the lips. Then take a deep breath, close your lips around the victim's nose and blow in 4 times. Remove your mouth and allow the victim to exhale. Another form of rescue breathing is mouth to stoma. This is necessary on a victim who has had a tracheotomy and breathes through a surgical opening in his throat. When resuscitating such a person, his head is kept straight with the neck level and air is blown directly into the stoma. The rescuer then removes his mouth and allows the victim to exhale. It may sometimes be necessary to seal off the mouth and nose. Sometimes, after prolonged CPR, the victim's stomach swells with excess air. This can elevate the diaphragm and reduce lung volume. To relieve such distension, first turn the head to one side to make sure the victim doesn't inhale any gastric contents. Then, using one hand, exert moderate pressure on the upper abdomen between the xiphoid and the navel. Clean all foreign matter from the mouth before resuming resuscitation. Vomiting is common during CPR, and the rescuer must often use this head-turning maneuver to drain off regurgitated materials. CPR is not a difficult technique, but it does require careful training and practice under controlled conditions. These are some of the more common errors. Compressing the xiphoid. This can lacerate the liver and cause internal hemorrhaging. Compressing the ribs can cause fractures and cartilage separation. Sudden or jerky compression can cause such injury as internal bleeding. They also are inefficient as they decrease the total volume of blood flow. Stopping CPR too soon. Never stop for more than 5 seconds until the victim recovers or you are relieved. In summary, remember the ABCs of CPR. A, open the airway and check for breathing. B, if not breathing, give 4 quick full breaths, then check for circulation. C, if there is no circulation, begin cardiac compression. This film is not a substitute for training. No one can learn CPR solely by watching someone else. But with practice under controlled conditions, with thorough training, and with applied knowledge, you will be able to maintain life until medical help can be obtained. With just your hands and lungs for tools, you can keep the life support system functioning. You can be the difference between death and life.